Hi, I'm Julie. I'm with Unity Point Clinics. We're here to talk back to school topics as we're getting ready with the state fair and we go right into back to school. Today I have with me Dr. Rendernick. Dr. Rendernick, as we get going back to school here, with the topic of COVID still around, are there any precautions I should know about as a rule to get started with my children?
Yeah, I think with COVID still being present in our communities, we still have to take extra precautions. I mean, that's just the way it's been for 2 years. I know we're all getting tired of this, but it really is still very important. By far, the first thing you need to do, make sure your child is vaccinated, okay? If they have had the primary series, they still should get the booster vaccine, okay? It's really important. I have it come up in the office all the time where parents come in. They're not anti-vax, okay? They're going to get vaccines, but they're just a little hesitant about this vaccine. I want to assure them that this is a very safe vaccine. It's been used now for long enough. Millions of kids have received it. I'm very comfortable with the safety record of this vaccine, and it is definitely the best way to protect your child from the disease. If they've received the primary, if they're 5 years and above, they can get the booster dose. Booster dose needs to be at least 5 months after their primary series has finished. It is no surprise that a booster is needed for this vaccine. If you look at all the vaccines we give during childhood, all of them have boosters months later. That's just how vaccines work, and this one's really no different than those others. So definitely look at the vaccine schedule, make an arrangement with your provider, and get your child vaccinated. The other thing that comes up frequently, and I know it's going to happen again this year, is masking. What do I do about wearing a mask? Should I? Shouldn't I? Who recommends them? Who doesn't? And that gets very confusing. I try to simplify it for myself, and when I talk to my patients, don't get caught up in the politics of masking. Okay? Listen to science. Don't listen to opinions of different people. If you go to CDC masking school guidelines, you're going to find out if they're recommended or not. The CDC recommends masking if certain transmission rates and levels of disease is present in our population. They have it broken down by county. So you can go there and find out, hey, should I be wearing a mask, or is there not enough transmission in this area that I really need it? Okay? Masks work. Despite what you hear from some people, they decrease transmission of this disease. And they do not cause problems from an emotion standpoint, from a disease standpoint. Okay, that's been well proven. Now we've had 2 years worth of data to look at. Masks are safe and they're effective. The other thing I'd recommend outside of those is stay home if you're sick. If your child's ill, use common sense. You don't want to be that person that ends up spreading it to other kids as well. It gets discussed very frequently. Kids don't get very sick generally with COVID. So why should I bother doing some of these things? It's all in your risk tolerance. COVID causes long-lasting symptoms in a lot of individuals, including kids. It's very well misunderstood and it's not understood well why that happens. We know the vaccine doesn't do that. The disease causes long-term issues in a lot of people, so take the safe route and definitely get vaccinated and wear a mask if it's recommended.
Thank you, Dr. Rendernick, for taking time to talk with us today. Parents, good luck this year with your back to school.